We are all here. And again, just excited. As many of you know, we find this segment of our agenda equally as exciting and invaluable to informing the work and recommendations that PACHA makes to the Office of the Secretary of Health and Human Services. Again, our mission, our charge is to do just that and really inform the Secretary around recommendations to help improve the lives of people impacted by HIV and those living with HIV. So this floor, this session, this platform is really open to you all, the public, and dare I say, to the members of the council around the table. If someone shares something that resonates with you or you want to ask additional questions, you are allowed to do so in this format. And for any of our colleagues that may be joining us around the country or in our federal agencies, et cetera, the floor is open. This is our less formal opportunity to exchange and engage in a way we naturally would if we were sitting in front of each other in the same room. So just appreciate those who have joined us and really want to open the floor for those who have comments or questions or just conversation to have with PACHA as a council. Caroline, I see you first. Go ahead.
Yes, I also wanted to encourage folks that are online joining to please use your hand versus the chat box, so folks that are viewing online can capture everything that's being discussed. Thank you.
Thank you, Caroline. And as I stated, the floor is open, and you all, I love to pick on wonderful faces. And of course, we have Avilio joining us today. Avilio, the floor is yours.
I appreciate this opportunity to talk to you about some of our work in Texas, our Texas Juntos y Juntas project initiative. Of course, we are very grateful to our leader, Guillermo Chacon, for supporting us in Texas. And just to give you a quick update, we have finished our behavioral health assessment with 6 of our agencies partners. And we just recently presented our findings on 1/4 of the data at the National Latino Behavioral Health Conference in San Antonio this past week. Super, super impactful. The room was packed, very interested topic. And we're very busy right now in the thick of it. We're working on our regional meetings. We already completed 4 regional meetings. We just finished one today. So we already finished meetings in El Paso, in Laredo, in San Antonio, and also just recently here in the Valley with Valley AIDS Council. So great crowds, great discussion. It's more focused on preventative health, so it talks about diabetes, cardiovascular disease, and other more important preventative health issues that are relevant to their communities. It's really impactful how to talk to these community members that work in other agencies besides HIV, because we have to talk to the aging group. We have to talk to people that are delivering diabetes services. It's really important because if we're serious about syndemics, then we gotta talk and do the walk about syndemics, both with our prevention and our care. So it's really important that we talk to all these different agencies and get a nice idea about how to better integrate and better get people screened, involved in the healthcare system, and not feel shamed to be entering the healthcare system and getting much more frequent preventative healthcare. We also are almost done with our HIV and aging initiative. A lot of the qualitative surveys have been completed. And we've already got one outcome out of that in Houston. The Ryan White Planning Council just recently allocated it and approved, and we're already working on implementing, hiring 6 medical case managers that are focused on aging and getting trained for the local capacity needs of Houston. And so we hope that the state dishes will be responsive to to the need of HIV and aging by presenting them all this qualitative data. These are public comment basically for 45 minutes, public comment about basically talking about their needs, both on the client side and also on the clinical side. And there's gaps there. There's serious, serious gaps. And what's so devastating and disappointing is what's happening on the border. HRSA, SAMHSA, these agencies need to improve the capacity that's happening on the border. It's a huge disparity between the urban haves and the have-nots on the border. We're looking at 8 different cities here, and it's very drastic. The stories about the clients are, I mean, I've listened to them and they're very, very impactful. It's a huge need. We need better integrated care. Better integrated care. We can't just treat HIV in a silo. These people cannot be going across to Mexico to get treated for the flu because their HIV clinic doesn't want to treat them for the flu. Those times, we gotta go beyond that. So that's my conversation with you, and I appreciate your time.
Thank you so much, Evelio. And, it's no secret. I've said it to Guillermo many, many times how grateful I am for the Latino Commission on AIDS to have a presence here in Texas, but certainly throughout the country and certainly along the border. The needs are great, and it's been an extraordinary sort of result and outcome from the work the Latino Commission has partnered with and facilitated and spearheaded extraordinary things. I really wanted to respond a little bit and sort of ask a follow-up question to you, Avilio. You gave one practical example of ways in which we can work together to provide greater or expanded access. And you mentioned the Houston example of the case manager specifically dedicated to those aging with HIV. From those syndemic convenings that you all have you had from other providers in non-HIV care, other practical ways by which we can partner and expand the delivery of more comprehensive services? Just interested in hearing any practical examples that have come up so far from the convenings that you all have had.
I think that we are still working in silos in these communities. We're still working in silos, even in Houston. The outreach or the integration of aging services into Ryan White is still something that is lacking. I'm more on the care side. I don't serve on the prevention side. I serve more on the care side, being a member of the planning council. But the idea is having practical meetings like these regional meetings, talking about preventative health. This is the start of something that should have started 60 years ago. And so these conversations about preventative health and integration in our minority communities, in our brown and Black communities, had not happened before. And I think bringing those agencies together and talking about how to improve preventative health and looking at their own data. We're creating PowerPoint data slides for each region. And so that's the idea of how do you do that? You start the conversation. How do we talk to each other? How do we better connect with each other? Dental services, all these other different things. Because one thing about Hispanics and Latinos is that we always get diagnosed very late, whether it's cancer, diabetes, HIV, different types of other preventable diseases. So, and it's similar to what's happening in the Black community too. But the idea is to figure out ways of creating much more capacity. And there's this talk about creating a universal, EMR or EHR within that regional community. And that's what they really want. That I've heard it 3 times in 3 different regional meetings. Better communication between the hospitals, the FQHCs. Those things are practical solutions, but we worry about patient confidentiality and HIPAA concerns.
No, I appreciate that. Thank you so much. Dr. Moore.
Thank you. Thank you. So, Avilio, I was really, really inspired by what you shared. Particularly, I was just thinking about how important it is for us to talk about HIV along with those other chronic medical conditions that you mentioned from that prevention angle. So, I was just curious, what has been the reception of those other organizations when it comes to this conversation about talking about diabetes, high blood pressure, and HIV, how we can have more like overall preventive health conversations?
It really varies between the regions. There's a lot of diversity in how each system is set up. Uh, in Houston, we have a much more integrated, tight, system of care, but other jurisdictions have much more looser and only want to focus on HIV. So then there's the referral. Some people don't have insurance, and then there's also the differences between people that are part of the Ryan White system of care and those that are not. So from what you can tell from the Ryan White Compass dashboard, they're pretty high performers. But then you look at the EHE jurisdictions on that dashboard, and they're not. But the integration of services is very crucial. I myself, I've been positive for 15 years. I mean, yeah, 15, 15 years, and I'm 50 years old. So this is something that we have to think about because we're rapidly aging a lot faster. And if you look at the data by age for Hispanics, mortality and viral suppression falls in those latter years. So it's really important to look at that because we need to prepare our system of care to address that large demand. We keep on adding new cases to the case managers, caseloads. The funding is still flat for I don't know how many years, and it keeps on shifting from jurisdiction to jurisdiction. So as a planning council, we're always talking about how do we integrate into other services, and we have to start creating that capacity.
Excellent. Thank you. Guillermo.
No, thank you, Evelio, and thank you, Leo and Marlene. I think it's critical also to share with all of you that this is a follow-up of a statewide assessment. Now we're validating and presenting the data that we collect that the providers and the people that were part of year one say, yes, that makes sense. I was in El Paso and I was so touched. First of all, the team is doing, like Marlene know, an amazing job because they go in for 7 days to hit, several areas. In Texas, as we know, is like Jupiter. It's their own planet, right? Then we start with Texas, and we start right now doing it in Florida. And people say to me, why you pick Texas and Florida? Because I told them it will be easy to do it where we are home base, or do it in North Carolina, who we have 15 years of working there. But we truly are committed about dealing with these issues. We need to go when it's more, the need is greater, and also when structural issues are really calling for all hands on deck. And our approach is to integrate the best that we can facilitate. And again, we have a lot of champions now in throughout Texas. And Marlene has been, a beacon of support and guidance, and we appreciate that. But I think this is the right space to share with you that we know all of that. We know that this work is hard, and that's the reason we need superheroes and superheroes to do this work on a daily basis, and always centering around people living with HIV. Thank you.
Thank you, Guillermo. It's an equity approach. And again, so much of that work is still needed, unfortunately, for many parts of our country. So thank you for lifting this up. Rania, is that your hand being raised?
That is my hand.
Your technical hand being raised. Go ahead.
I was like, let me find the button. I took my glasses off. I can't find it. Moves faster. It's one, I want to say, Avelio, thank you so much. You highlighted the issues in Texas and really on the border so well. and the work that you're doing is so important. And Guillermo, the work that LACOA is doing is so important. I think the type of national organization that can be able to be responsive and flexible and come in with research and help build coalitions. And it is that kind of other work that is so important, that is not necessarily tied to a number of HIV tests, that's not necessarily, tied to those types of HIV outcomes, but it's about building the determination, the capacity, and reach of people who are actually impacted by issues is how we are going to be able to say we got to the end of HIV. And I think specifically for Latino communities, like Latinx communities right now, like that is more important than ever, especially from these numbers that we've seen. And just to highlight that, I think Latino leaders have been saying this for a long time. So before we saw the numbers, there was concern and flags and, this is not looking right. And so why it's even more important, again, to be able to have organizations that can be that voice. I think, shout out to you guys. And I think, Guillermo, I think as a PACHA member, I love you as a person. And then Avilio, folks like you who are doing that work in community is really important. So it's just some love showering. And I appreciate this conversation.
Thank you.
Thank you for that. And again, I'm reminded of every time we've done PACHA-to-the-People with that vision of going out and really engaging in community about what's most concerning to them. I'll never forget our time we spent in Phoenix, where I think I was brought to tears just, hearing and learning about the experiences of what is happening with our Native brothers and sisters. And then again, obviously, I've been dying for you all to experience Texas, and we had a chance to do that. And we're headed toward Alabama in December. And the idea that we will be centering our conversations around what I think you just said it right, what advocates have been beating the drum about for so long, about where we're continuing to miss these opportunities. So I do think that it's such an important part of our work. If there are others who want to chime in, because I think the launch of new data, relevant, up-to-date data is vital. And it was in our conversations yesterday and in our conversations today about having a more data-driven response in those communities that continue to show up in the data as us sort of missing the mark. It's what we say is the hardest work left to do. But I'm not sure about if we can label it hardest. I do think it's different work that's left to do. It's more systemic, it's more policy, it's more of the equity approaches that Guillermo is talking about. So for me, I'm encouraged about having the ability to allow the data to inform what we need to do next. And unfortunately, it does say there's much to do, but just wanted to point that out about the connection between PACHA-to-the-People, what we learn, and how our work is firmly guided and should be guided about what we're learning, both in the quantitative data as well as the qualitative that we hear from communities. I'm not going to preach for 20 minutes. I just wanted to share my thoughts about that. But is there anyone else who wanted to take opportunity and space to sort of have a bit of reflection or share comment? Amen, Leo, in the chat. Leo talks about how important it is that the data being collected by community and shared back with community. I just left the National Brian White Conference talking about that, meaningful engagement of people living with HIV and community really centers and starts with, how are we gathering the information that's telling us we have a problem in the first place? And the idea that information and what we interpret from it also be informed by the communities that we're seeking to describe. We may have some assumptions there. So thank you for bringing that up, Leo. Alicia, I see your hand. Go ahead.
Thank you. This message,
comment or question is for Avilio. I understand, and I'm very happy to hear that you said you have 6 case managers that are focusing on the aging population. I think that is amazing. My question to you is, do you find that there are specific resources that your case managers are in need of that would assist them in being more successful in engaging the aging population?
The administrative agency has contracted with our local AETC to provide specific training modules that are specific to Houston for to meet the capacity that we have. We don't have the same capacity as other jurisdictions. So that's the important part, is that we're still early on in the wave of aging where we can address it with time and train and hire qualified professionals that can address this issue. I think it's important that the community come up with its own training for what its capacity is locally. I know there's a debate about national widespread kind of overlapping needs, but I feel that we have to be realistic with our resources in Houston. So 6 medical case managers, I'll take them.
Go ahead, jump in, Leo.
I just want to say, when I'm thinking about HIV and aging, I'm also thinking about, as early as someone is diagnosed, kind of planning for that aging too, that there's not just like this kind of set age where we're like, okay, now you need case management, or now you need discussion about aging. It really is that we're thinking about the entire process, so we're thinking about, are you getting your cholesterol screenings? Are you getting your diabetes screening? How's your weight? All of those things, and that we're starting as early as possible so that we help people who are living with HIV in the same way we would help those who are not live their longest and healthiest lives.
Lots of applause around that one. Absolutely. Anyone else? Go ahead, Andrea.
Good afternoon, everyone. It's Andrea with the Administration for Community Living, and it's wonderful to hear the discussion of HIV and aging. I'll just say I have a colleague who has a t-shirt that says, if you're alive, you're aging. So, let's start now. I just wanted to circle back to a comment that Terry made, and Avilio, I heard kind of mention of it as well. And this is discrimination on the basis of HIV status, whether it's in a nursing facility or a health clinic. And I don't hear us talking a lot about anti-discrimination laws administered by the Department of Health and Human Services Office for Civil Rights. And ACL really worked closely with OCR on its update of the Section 504 regulations of the Rehabilitation Act of 1973. And it does prohibit discrimination on the basis of HIV status. And that is just HIV status. It's not if you're symptomatic and you're profoundly physically disabled because you have full-blown AIDS. It's HIV status against if anybody who receives federal funding from the Department of Health and Human Services. So that's anyone receiving Medicaid funding or Medicare funding or Ryan White funding. If you go to OCR's website, they actually have a website about complaints and compliance actions against healthcare providers who have discriminated on the basis of HIV status. And they list, nursing facility, I believe there's assisted living facility who is getting Medicaid funds on that list. It hasn't been updated in a while. But it is just a good example of some compliance actions that have been taken against healthcare providers who have discriminated on the basis of HIV status. I know we have a representative from OCR that attends the NHAS implementation work group. So they are engaged and aware of this, certainly. And so I just, wanted to mention that because I think it's an important law, certainly.
Outstanding, Andrea, for reminding us of those resources. And to Terry and Caroline, I see you also added some additional resources in the chat. So I do encourage folks to make use of those, especially for work that is being done on the ground. Anyone else? Okay, seeing none, we were scheduled to have this conversation go up until 10 minutes after the hour. I see we're joined by another PACHA member in the making, and we are happy to see him all the way from Los Angeles, California. What a great addition to the meeting. And definitely just want to say thank you all for your engagement. Avilio, as usual, you are putting excellent information and food for thought, and just thanking our other commenters as well, Rick Kutcher and Terry. Thank you for chiming in earlier and providing your experiences. With that, I do think we can probably go ahead and recess this session, take a bit of a break. We were in our, scheduled to have 10 minutes for our break. If we can return promptly at 4:20, I think that would be great. And we've made up a bit of time. There's a question from Leo.
Are we going back to the other link is the question.
Yes, we're going back to the other link. Thank you for reminding the group about that. So we'll see you all back on the other side in 10 minutes. Thank you all.
Produced by the U.S. Department of Health and Human Services.